So the executive director of health and community education at Piedmont Health in Atlanta, as well as the Healthy Morning contributor, joins us now. Dr. Morgan, always good to see you. Now, when I saw this headline, there was a part of me that said, okay, well, maybe this is good news, right? Because that number has been elevated, hopefully, because it's never good to see that mortality death rates rising. But what does it really mean? How should we read into these numbers?
We should, and we should have some caution with this, because the fact of the matter is, when we look at the death rates, we have to look at the definition of what maternal mortality is. And that definition by the CDC counts maternal mortality anywhere from pregnancy up to 6 weeks after that pregnancy. But we know that mortality is also associated almost up to a year because of any number of complications that can occur well beyond that 6-week period. So in addition to that checkbox that has been added by the CDC, there's an entire plethora of issues we also need to address, starting with the definition of maternal mortality and whether or not that should be expanded and whether that captures actually the true picture of what's happening in maternal mortality.
Yeah, it's interesting what we're seeing on our screen here, just those checkbox right there. Pregnant at the time of death, not pregnant, but pregnant within 42 days of death. There's a lot of stipulations here.
That's right, those 42 days are the 6 weeks.
Right.
That's right.
Yeah, and 1 year before death, unknown if pregnant within the past year. And I can see how that could get a little bit confusing also.
That's right.
What are some of the leading factors, though, behind these numbers on maternal mortality rates?
You know, such a great question, Alex. When we look at the death rate, the maternal mortality, 2019, it was about 20 per 100,000. Then in 2022, a jump to almost 24. But then from 2020 to 2021, it went to 33 deaths per 100,000, and for Black women, it was 44 deaths. We actually are one of the most dangerous countries in which to give birth in the entire world, in the United States, and so we should not be bragging about being #1 in this category. So what's happening? Well, for one thing, mothers are older. Advanced age, women are delaying pregnancy in some aspects because of whatever reasons, careers or other options. They've gotten married later, marriages are being pushed back later. And with advanced age comes what? More medical conditions that have developed over that period of time that now have to be managed during those pregnancies. So we know advanced age is one of them. Also the chronic medical conditions. We also have these formulas that we really hopefully have phased out by now, but it's been pretty recent. And these are called VBAC formulas, vaginal birth after cesarean section. And these formulas had a race factor in them. And that race factor, if you were Black or Hispanic, would categorize you towards your physician guiding you to have repeat cesarean sections. And cesarean sections are, let's make no mistake about it, surgeries.
I had one.
That's right. These are surgeries.
It was not
So we're
great.
having repeat surgeries, right? It's no joke.
Yeah, no.
Right, and there is a recovery period, and surgery comes with surgical complications as well. And so we've got to begin to look at this whole compilation of what's happening, and then we talk about these desert areas where there are not physicians, where there are not pharmacies, where there are not other types of providers. Women are not getting prenatal care, they're not getting postnatal care. All of that. So it all wraps in. We've got to figure out what demographics are being impacted, because this is the United States of America.
And it's
Why
2024.
are we so high in maternal mortality? It's safer to have a baby in another country than in the United States. That is horrific.
That is. So really quick, we're just about out of time, but what I noticed going through my, prenatal, then actual delivery and post birth was that I'm in the doctor's office every month in the beginning. I live at the doctor's office, right? But after you get that 6-week checkup, and it's like, okay, bye-bye, good luck.
That's
Do you think we're going to see a shift then with these numbers coming out, and eventually over time, do you think we'll see a shift to a little bit more emphasis on that post-birth experience?
You know what? Such a good point, and we are pushing to get an expansion, not only of that definition, but women to have follow-ups up to 4, 6 months, maybe even up to a year, such such that we can capture what these issues are. Because as a cardiologist, the majority of deaths of maternal mortality are due to heart disease and blood clots. And we've got to begin to make those connections, especially pregnancy complications like preeclampsia, eclampsia, gestational hypertension, gestational diabetes. All of those are going to increase your risk of heart disease and heart death later in life, including in that postpartum period. So we've got to wrap our heads around this and really move forward. It's really, it's atrocious that the United States is leading in this area.
Let's not even talk about the stress of going back to work.
That's right. Let's not.
That's a whole different conversation. All right,
that
we can
is
get
a
into.
conversation that I also have done 3 times. It's not for the